Welcome to the Deep Dive, where we sift through the noise and extract the most important nuggets of knowledge from the sources you've shared with us. Today, we're diving into a threat in the cattle industry that often goes underestimated, even though it's pervasive: Histophilus. It's a truly complex challenge capable of acting as a silent killer and exacting a significant economic toll without much fanfare.
That's right. And our mission here in this deep dive is really to pull out the core insights from the material you've provided on Histophilus somni and the multifaceted disease it causes. The goal is to ensure you walk away understanding not just what this bacterium is, but critically why it's so challenging to manage, and maybe most importantly, what real-world steps can actually be taken to combat it effectively.
Okay, so let's start at the beginning now. We're talking about Histophilus somni, a gram-negative bacterium. I found it interesting that it was formerly known as Histophilus somnis. Can you maybe unpack that for us? And what makes Histophilus somni particularly unique?
Yeah, it's a great starting point because that reclassification, it wasn't just a name change. It really reflects a deeper scientific understanding of its distinct genetic and phenotypic attributes. This bacterium is, morphologically speaking, pretty fascinating. It's small, pleomorphic, which, means it can vary quite a bit in shape, and it's a non-spore-forming bacillus. What's really notable, and frankly kind of a challenge for labs, is its fastidious nature. It's quite picky about its growing conditions. It typically needs a 5 to 10% CO2 atmosphere, and its growth gets a boost from specific nutrients like pyridoxine and flavin mononucleotide. Genetically, sure, it shares significant homology with some others like Haemophilus influenza and Actinobacillus ligneureii, but it's definitely unique enough to warrant its own genus.
Right. So we have this unique bacterium, H. somni, but the disease it causes sounds broader. It's known as histophilosis or the H. somni disease complex, HSDC. Sounds like it's not just one single issue, but something that can affect multiple systems in an animal. Is that right?
Precisely. Yeah, HSDC isn't a singular disease with a neat little set of symptoms. It's a broad spectrum of clinical manifestations that can hit multiple organ systems. While it's primarily a huge concern in cattle, you do see it pop up sporadically in sheep too. And its distribution is, truly global. It's reported across North America, US, Canada, various European countries, Brazil. It's definitely not just stuck in one place.
Okay, and here's where it gets really interesting, I thought. The research shows H. somni is widespread, right? Some herds even have 100% seroprevalence, meaning basically every animal has antibodies. Yet the clinical incidence, the actual sickness, is often remarkably low, sometimes 2% or less. What does that huge disparity tell us?
It tells us something pretty fundamental, actually. H. somni is largely an opportunistic pathogen. It commonly just lives as a harmless commensal, a normal resident, in the mucous membranes of ruminants, especially in the reproductive tract. The really critical point is that clinical disease only seems to emerge when specific predisposing factors or host vulnerabilities are present. That's when it shifts gear, basically, from being harmless to being a virulent pathogen causing trouble.
Okay, that makes a lot more sense. I also noticed a curious seasonal pattern in the data. Most cases seem to happen between October and January. Is there a reason for that specific timing?
Oh, absolutely. That seasonality is strongly linked to environmental stressors, specifically abrupt temperature changes or really cold conditions. Think about how those shifts can compromise an animal's immune system, making them more susceptible. These environmental triggers can essentially, flip the switch, causing what was maybe just a subclinical carrier state to blow up into full-blown clinical disease. It's a clear example of environment impacting immunity.
Wow, so it's like a master of disguise, potentially, never showing its hand until it's maybe too late. That must be incredibly frustrating for producers. It really sounds like a silent killer, capable of causing sudden death sometimes without any prior signs. Can you walk us through the different ways this bacterium shows up clinically?
It truly can be insidious, yeah. And its versatility lets it cause a whole range of problems across different body systems. So first off, it's a major component of what we call bovine respiratory disease, or BRD. That's a big one. Here, it causes a pretty severe form of pneumonia, fibrinous pleuropneumonia. The signs are often nonspecific, things like fever, depression, labored breathing, maybe some nasal discharge, a soft cough. But the progression can be incredibly fast. Death is possible within 12 hours sometimes. And transmission here is typically through respiratory secretions. Then there's thrombotic meningoencephalitis, TME, often just called Brainer. This is a really severe neurological form, particularly common in feedlot cattle, maybe 6 to 12 months old. Affected animals show fever, depression, they're uncoordinated, that's ataxia blindness. seizures, involuntary eye movements called nystagmus. And ultimately they go down, recumbency, often leading to death within days. Post-mortem, you'd find a really distinct sign. Purulent meningitis, hemorrhagic, areas of dead tissue from blocked blood flow in the brain. And that characteristic necrotizing vasculitis and thrombosis in the brain's blood vessels. Myocarditis is another devastating one. It causes necrotizing myocarditis and myocardial infarction, basically heart attacks. This often results in sudden death with absolutely no prior signs. And it frequently hits a specific part of the heart, the papillary muscle of the left ventricle. And then when it comes to reproductive disorders, we see issues like infertility, including prolonged calving to conception intervals and late gestation abortions in females. In males, it can cause epididymitis. Beyond those main ones, it can cause other systemic issues too. Things like septicemia, which is just rapid bacterial growth throughout the body. We also see pleuritis, polysynovitis, or arthritis, often in the stifle joints, laryngitis, otitis, which can present as an ear droop, mastitis, foot rot, even conjunctivitis and choroiditis. It really is a multi-system threat.
That's a staggering amount of damage from such a tiny organism. How does this opportunistic pathogen actually manage to cause such widespread devastation across so many different systems? What are its tricks, so to speak?
It employs some incredibly sophisticated virulence mechanisms. It really does. It starts with its ability to adhere, stick to mucosal surfaces and those bovine endothelial cells, the ones lining blood vessels. Then it forms biofilms. These are like communities of bacteria wrapped in a protective matrix. These biofilms help it persist, stick around, and can even shield other pathogens like Pasteurella multocida in chronic BRD cases. Think of it almost like a microbial fortress. For immune evasion, its lipo-oligosaccharides, or LOS, are absolutely key. They provide protection, they act as adhesins, helping it stick, and they function as endotoxins. Critically, they can undergo antigenic variation, meaning they constantly change their outer coat effectively to evade immune recognition, like changing disguises. It can also inhibit neutrophil killing. Neutrophils are a type of immune cell and survive inside phagocytic cells. It basically uses immune cells as taxis to spread throughout the body. The primary damage it causes pathologically is vasculitis, inflammation of blood vessels. This often comes with thrombosis, blood clot formation, and septic infarction tissue death because of that blocked blood supply. This whole cascade leads to widespread endothelial cell death and a massive inflammatory response. And finally, a really crucial ability is acquiring iron from the host. It needs iron to multiply. Studies have actually shown that calves with lower pre-exposure levels of serum transferrin, that's an iron transport protein, developed more severe pneumonia. So getting iron is a huge deal for this bacterium's success.
That's incredible how strategic it is.
Yeah.
Almost seems intelligent in a way. So, given the nonspecific clinical signs and how often sudden death occurs, diagnosing Histophilus sounds like a real nightmare. How do veterinarians and producers even start to suspect this particular threat?
You've absolutely hit on a core difficulty there. It is a diagnostic dilemma. You should really strongly consider Histophilus in cattle, showing, well, any combination of respiratory and neurological signs, especially in feedlot or dairy calves or even grazing cattle. The context, the epidemiological context, is just key. Look for those stress factors: weaning, shipping, mixing cattle, and like we talked about, those abrupt temperature changes, especially during its peak season, October to January. Early recognition is absolutely paramount if you want any hope of treatment success because, yeah, sudden death is unfortunately common.
So if you suspect it, how do the labs step in? Especially since clinical diagnosis is so tough and the bacterium itself is, so picky about growing conditions.
Lab methods are pretty much indispensable for confirming it. For sample collection, H. somni can potentially be isolated from blood, CSF, joint fluid, lung fluids, and tissues like brain, liver, or kidney. For respiratory disease, a bronchoalveolar lavage, or BAL, is definitely recommended over just a nasal swab. It gives you a much better sample from down in the lungs. And post-mortem tissues, they need to be collected rapidly to preserve the bacterium before it degrades. Culture, as you said, is challenging exactly because of its fastidious growth needs and its sensitivity to antibiotics. It absolutely needs that 5–10% CO2 atmosphere. And other common bugs like Mannheimia hemolytica can easily overgrow it on the culture plate, making isolation really difficult. This is precisely why molecular assays, things like PCR and real-time PCR, are highly recommended now. They're just much more sensitive and specific. They can detect the H. somni genetic material even in carrier animals or in animals that are already on antibiotics, which is a massive advantage. And then post-mortem, histopathology and immunohistochemistry are invaluable. They reveal those characteristic lesions we talked about: myocardial infarction, necrotizing myocarditis, those hemorrhagic infarcts in TME cases, necrotizing vasculitis, thrombosis, fibrinous bronchopneumonia. Seeing those under the microscope is almost definitive. Serology, on the other hand, that detects exposure antibodies. It's useful for herd-level surveillance, to understand how widespread exposure is, but it's not really the go-to tool for diagnosing an active acute infection in an individual animal.
Okay. And it sounds like there's a whole list of other conditions that could easily be mistaken for Histophilus. What are some of the key differential diagnoses that vets really need to rule out?
You're absolutely right. It has plenty of mimics. For the neurological form, TME, you'd need to differentiate it from things like polioencephalomalacia, that's coleo lead poisoning, salt poisoning, listeriosis, bovine herpes virus, encephalomyelitis, even rabies sometimes. For the pneumonia aspect, Mannheimia hemolytica is a huge differential. Always comes up. And myocarditis, well, that could look like other parts of the BRD complex or even just congestive heart failure. Those nonspecific signs really force you into a comprehensive diagnostic workup to rule everything else out.
So given all these hurdles and actually pinpointing it, what's the kind of the core takeaway for diagnosing this disease effectively?
The real nugget here, I think, is that you often can't afford to wait for those classic, really obvious clinical signs. By then, it's frequently too late. Its vague presentation, plus the difficulty of culturing it, really pushes us towards needing rapid, almost predictive diagnostics, especially those molecular assays, the PCRs. And the presence of those distinct pathological lesions at necropsy is just invaluable, even in sudden death cases. It tells you what happened. And here's that interesting link again.
The host's nutritional status, specifically iron levels, seems to influence susceptibility to severe disease, which does suggest a potential nutritional management angle to explore for prevention, which is pretty fascinating. That is a fascinating insight. Okay, so given the rapid progression we've talked about, if you do suspect Histophilus, what are the effective treatment protocols? What therapeutic options are there? Is there really that narrow window for success?
Oh, absolutely. There is a very narrow window. The key is early and aggressive antimicrobial therapy, plus robust supportive care. Time is absolutely of the essence.
Which antibiotics are generally recommended then? And how critical is that timing?
Fluorophenical, ceftiofur, oxytetracycline, and high doses of parenteral penicillin are the mainstays. Timely administration isn't just important, it's critical for efficacy, especially for TME, where you need antibiotics that can actually cross the blood-brain barrier effectively. The sources are pretty blunt about it. Outcomes can be less than rewarding if treatment is delayed even a little. And of course, there's the ever-growing concern of antimicrobial resistance, so, prudent use is vital. We have to remember that just because it works in a lab dish doesn't always mean it'll work perfectly in the field because of things like biofilms or the bacteria hiding inside cells.
Right. And what about that supportive care you mentioned? What does that actually involve?
Supportive care is really vital for the animal's comfort and hopefully recovery. Fever reduction using NSAIDs, nonsteroidal anti-inflammatory drugs like Flunix and Meglumin, that's crucial to make them feel better and hopefully encourage appetite. Beyond that, just general supportive measures, providing electrolytes for rehydration, easily digestible nutrition, especially for those really sick or down animals that probably aren't eating or drinking normally.
I've heard the term metaphylaxis used in herd health discussions. How does that fit in here?
Right, metaphylaxis. It involves strategically giving prophylactic or preventive antibiotics to high-risk groups. So, for example, if you have incoming cattle that are really stressed, or maybe if you identify a few sick animals within a group, you might treat the entire group proactively. The idea is to prevent an anticipated outbreak or stop further spread within that group. It's a preventative measure in those high-risk situations.
Okay. So what's the bottom line for treatment then? It really sounds like a serious race against the clock.
It absolutely is a race. The core implication here is that once those severe clinical signs hit or irreversible pathological changes happen in the body, treatment is often, frankly, unsuccessful. This just highlights the immense value of having rapid diagnostic tools and really good monitoring systems on farms. Catching it early is everything. There might also be benefits to combination therapies, maybe pairing an antibiotic with an NSAID to tackle both the infection and the inflammation. That could lead to better outcomes. But ultimately, yeah, early detection, early intervention, that's key, alongside that constant need for strategic, careful antibiotic use because of resistance.
Yeah, that makes sense. So given those treatment limitations, prevention clearly becomes absolutely paramount. What do vaccination programs for Histophilus look like right now? And what are the sort of the challenges with them?
Currently, what we have are commercial killed whole cell vaccines, often called bacterians. However, their effectiveness out in the real world, in field conditions, is often pretty limited and quite variable. It's not always reliable. This is likely due to several factors. There can be an antigen mismatch. What the bacterium shows, the immune system in the lab vial, might not be what it shows inside the actual animal. They also contain relatively large amounts of endotoxin, which can sometimes cause adverse reactions in the cattle. And crucially, they often fail to induce that really strong cell-mediated immunity. That's the part of the immune system that's critical for clearing out intracellular pathogens, bacteria hiding inside cells like Histophilus somni does. So it's a significant gap in protection.
That does sound like a significant vaccine gap. Is there ongoing research then into novel vaccine candidates trying to address these limitations?
Oh, absolutely. Researchers are definitely focusing heavily on developing vaccines using components that the bacterium actually expresses in vivo, when it's actually causing infection inside the animal. Things like its iron-binding proteins, components of its biofilm matrix stuff that's really vital for its survival in the host. Outer membrane vesicles, OMVs, are also a very promising avenue. These are like little bubbles the bacteria release naturally, packed with a wide range of antigens. The hope is that these can induce stronger immune responses, both the antibody kind, humoral, and that crucial cellular immunity. It's basically about teaching the immune system to recognize the pathogen's real battle dress, not just its lab coat.
Okay, that's fascinating on the science front. Let's pivot a bit to biosecurity measures. What are the fundamental practical steps producers should be taking on the ground?
Yeah, the practical stuff. Strict hygiene and sanitation are just foundational. Non-negotiable, really. This means thorough cleaning and, importantly, drying of pens before new calves come in, regular bedding changes, daily scrubbing of water troughs, that's a big one, daily cleaning of feed bunks, and meticulous scraping, washing, and disinfecting of transport vehicles between loads. A good rule of thumb I heard once is, if you wouldn't want to lie down in that pen yourself, neither should the animal. It kind of highlights the level of cleanliness we're aiming for. And beyond the environment itself, equipment sanitation is absolutely critical too. This includes things like frequent needle changes for injections and thoroughly cleaning and sanitizing all veterinary equipment. Think dehorners, castration tools, ear taggers between every single animal. You really want to prevent any mechanical spread.
Right. And how do the bigger picture herd management practices fit into this whole prevention puzzle?
Minimizing stress factors is paramount. We keep coming back to stress because it's such a primary trigger for this opportunistic bug. So that means trying to avoid long-distance transport if possible, preventing overcrowding, limiting the mixing of cattle from different sources, and trying to mitigate those abrupt temperature changes, especially the cold snaps. Optimizing feed and water intake, making sure there's enough bunk space, for example, and strategically separating new arrivals for a period are also key management tools. A comprehensive vaccination program for all incoming cattle, even with the current vaccine limitations, is still vital for providing at least some baseline immunity. And while completely eradicating carrier animals isn't practical, managing the herd to try and reduce the overall pathogen load in the environment is definitely important for long-term herd health.
Okay, so putting all these prevention pieces together, vaccines, biosecurity, management, what's the core message we should take away?
The core message is pretty clear, I think. Because of those current vaccine limitations and the pathogen's really clever immune evasion tricks, management is key. It truly is the best defense right now. And remember, H. somni often acts synergistically, works together with other bugs within that whole bovine respiratory disease complex. So prevention really needs to be an integrated strategy. It's about tackling multiple pathogens at once and really emphasizing stress reduction and meticulous hygiene to create a more resilient herd environment. It's an ongoing battle, and good management is definitely your primary weapon.
That really drives home the need for a holistic approach, doesn't it? Let's shift gears one last time now to the financial side, the economic toll of histophilosis. What kind of impact are we talking about for the cattle industry?
The economic impact is substantial, no doubt about it. And H. somni is a significant contributor to that bovine respiratory disease complex, BRD, which the sources explicitly identify as the main reason for economic loss in feedlots. Unquote. We're talking huge numbers attributed to the whole BRD complex, something like 75% morbidity, sickness, and more than 50% mortality, death. H. somni plays a big role in that.
And focusing just on this specific disease, histophilosis, what are the direct economic losses we're looking at?
Well, direct losses come straight from high mortality rates. In outbreaks, these can range anywhere from 5% up to 25%, or sometimes even more of the affected group. That's devastating. And to put some dollar figures on it, for BRD treatment costs, which H. somni contributes heavily to the average in the U.S., is around 18 USD per sick animal. But that can easily climb, potentially over $37 if multiple treatments are needed. We see similar figures reported from Northwest Mexico, roughly $16 to over 38 USD per animal. Those costs add up incredibly fast, especially in large operation.
Yeah, absolutely. And what about the indirect economic losses? The ones that are maybe less obvious but still add up significantly.
Oh, yeah. These hidden losses are just as impactful, sometimes more so in the long run. They include things like reduced production, so decreased milk yield in dairy cows, significantly decreased weight gain in beef cattle. You also just see reduced overall body weight because sick animals don't eat as much, their health declines. There are increased culling rates, having to remove chronically ill or unproductive animals from the herd prematurely. On the reproductive side, it causes major inefficiencies. Infertility, longer times between calving, those late-term abortions, all costly. And naturally, there are increased veterinary needs, more diagnostic tests, maybe prophylactic treatments, consultations, all adding to the operational costs day to day.
So, pulling all that together, what's the overall financial burden that histophilosis represents?
It really reaffirms that this is a substantial financial burden, particularly a persistent threat to the beef cattle industry. H. somni seems to disproportionately contribute to mortality and treatment costs within that bigger BRD picture. And crucially, those hidden losses from carrier animals that look healthy, from subclinical infections dragging down performance mean the true economic burden is probably often underestimated. Ultimately, effective stress reduction management, all those things we talked about, doesn't just improve animal welfare, it indirectly leads to significant economic savings by preventing these costly outbreaks. It really is a clear case where prevention pays dividends.
It's incredibly clear. Histophilosis is this complex, multi-systemic, gram-negative bacterium. Often acts as a silent killer, so challenging to diagnose and really difficult to treat effectively if it's not caught extremely early. It seems abundantly clear that an integrated management approach, really focusing hard on prevention, is absolutely essential.
Indeed. Disease prevention, especially with the pathogen as, well, sneaky as Histophilus somni, it isn't just about animal welfare. It's a critical economic imperative. Those proactive measures, even if they seem costly upfront, fundamentally prevent far, far greater losses from this silent killer down the road.
So given this complexity of Histophilus somni, its hidden carrier state, and its really profound economic impact on cattle, here's something to think about. How might some of these cutting-edge technologies, things like remote health monitoring, maybe AI-driven behavioral analysis, or even novel biomarker detection, how might they revolutionize our ability to preemptively address insidious threats like this in livestock? Could they allow producers to intervene long before clinical signs even appear, potentially preventing those devastating losses altogether? Something to consider.